Good morning, I'm Dr. Deuk. We are not broadcasting, but we are recording. This is a Deuk plasma rhizotomy. And this patient has facet joint pain and does not want to do the standard rhizotomy because you always have to come back and get them done over and over again for like the rest of your life. So what we talked about doing was the Deuk plasma rhizotomy, which is a less invasive shot. It is a less invasive way of getting a more permanent pain relief shot. And the reason why it's less invasive is I used to do these as part of my open surgeries, my fusions, in which case I would use the bovie to shot. I would use the bovie to, we're right there, literally to the hilt. Shot. Yeah, we would use the bovie to basically, shot, denervate the facets during that surgery. And so I started to apply that technology to treating the facet joints without the fusion part, without the laminectomy and fusion part. A bit of scar tissue here because the patient's had laminectomy before.
Thank you.
It looks like the TP's right there, right?
Yes, looks like it, sir.
Yeah, I have to push down to get it. Shot? That's okay. We're all right.
Okay.
But we're right there, you know. I like literally have to hold it down. All right, we're going to get started. It's actually October.
Yes, sir.
October 4th, 2022. We've done probably 15 Deuk plasma rhizotomy, cervical and lumbar. And go ahead. And this patient, we started doing them about 8 months ago. And this patient, that's good, that's enough. This patient came to us from Arizona. He had had the Deuk laser disc repair and had great results. He had a laminectomy in the past. Shot. I didn't do his laminectomy. It was actually done by another doctor, I think near his home. And shot. And basically, he came to us. Let me have that, Coker. Yeah. Came to us for the disc problems he was having, and he was having disc problems for sure. And we did the Deuk laser disc repair, and his disc pain is completely gone, and he's very happy with that. But shot. He's suffering now with facet joint pain. Shot, which I confirmed on examination yesterday in clinic. You can feel a lot of scar tissue here. And unfortunately, rhizotomies don't work too well when you have scar tissue. Shot. So I don't think a rhizotomy would work very well for him. Okay. Let's see where we are. I feel bone. That feels and looks good. I'm sitting on the bone, right where the transverse process meets the facet. Shot. Shot. Now he has a pretty deep back. That's just his anatomy. Shot. 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 Sitting right on the TP. Sliding up at the top of the TP. So that's kind of the top edge. This is kind of where I want to be, right here. Shot. 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 That looks pretty good right there. All right, we're done with that one. I'm gonna come out and we're gonna get ready to go to the next one.
You want to
Yeah.
another one? Or
Huh?
you want another niggle? Or
No, same one.
it's fine? Okay.
I mean, it's a stretch, but it should be okay. The sacrum's a little shallower anyway. Shot. All right, so now we're gonna head down to the sacrum and shot. We're gonna go right where the superior S1 facet comes out basically, and shot. Right at the junction of the superior facet lateral to it. Shot. 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 A little too inferior. I feel it sliding on the bone. Shot. Shot. I feel like I'm going in this foramen. Need to be a little more superior. Shot. Shot. I mean, that's the really good location, but again, I'm not really. There it is. Hold on. I'm having to push down. Shot. That's perfect. That's the exact spot you want to be. Can see just to the, go ahead and use the arrow just to the right of the needle tip. Yeah, that little bone right there, that triangle right there. Show them. Yep, right there. That's the lateral surface of the superior facet of S1. Basically, that's the S1 superior facet. That's our target, just lateral to that, right where we are, exactly. If there was a most perfect positioning, that would be it. Shot. Nice. Could I already be there? That's not possible. Shot? No. Shot. Yeah, shot. I was gonna say. Shot. That's more to inferior. Shot. That feels pretty good. Yep. That's where we need to be. Shot. Just a little medial. Want to be just a little bit lateral. Shot. I think that's too superior. Yep. Shot. That's good. A lot of scar tissue. I can feel tons of scar tissue from his shot surgery. That's not the surgery I did. That's his laminectomy. I'm feeling the scar tissue from. Shot. Yep. Shot. It's like the perfect place right there. Nice job, Dr. Berndes. 30 seconds more here and we're done. Shot. That should be it. Knife. Let's cut this.
Oh, yeah, the lights, please. Thank you.
All right. We're done with the left side at L5S1. We're going to go over to the right side. He has facet pain on both sides. Yep. So I need to do something there. It's not bad actually. Let's do some more num-num. I probably have to do 2 incisions here. They're too far apart, I think. I was trying to split the difference and shot. 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 That's getting better. Shot. Mm-hmm. You like that, Jordan? Shot. What? I couldn't hear you.
A little too medial there, but it looks like it's going towards it.
I think we're good. I feel bone. I'm a little inferior. Shot. But that's really good right there. I'm right at the junction of the transverse process and superior facet. We do a little depomedrol, and then I do a little lidocaine and marcaine as I'm coming out. Go ahead. And yeah, that's nice. That was very nice. These are stab incisions. They're only 3 millimeters. Unfortunately, you can't really see what I'm doing because this fluoro's in the way, but eventually we are going to be able to start actually broadcasting these, just not yet. Shot. 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 There's some bone. That's nice. right on the TP. I'm feeling literally scraping right where the TP joins the superior facet. Coker,
Ready?
it's beautiful. And it's such a nice procedure. Shot? Oh yeah. I think that's really good. Lay still, we're almost done. All right, so I think we're gonna have to go lower. And I already numbed them up. We've done with the nerve, it's the medial branch of the dorsal ramus. Let's go to 5. Let me see 5 a little better. I mean, it's not terrible there, Jordan. But we're done with the medial, and you can see the scoliosis he has because he's had that laminectomy done elsewhere. You can actually see the laminectomy defect on the x-ray. And that laminectomy, unfortunately, has created that curvature of his spine, I think, or contributed to it. A little bit too dark, but let's see what we've got. Take a picture. I think I see the TP there. Let me see if I can get to it from here. Shot. Shot. So I'm kind of aiming just for the lateral margin, shot, of the pedicle, shot, where it joins with the transverse process, shot, shot. And these needles are directional, so you can use them to your advantage. Shot. I think I'm a little higher. It's not bad right there. There's bone. Shot. And we're sunk to the hilt. What do you think, Jordan? Luis? Yeah, I think it looks good. Go ahead. Oh, wait. Yeah, you got it? Okay. I thought this was it, but you got another one.
Yeah. Right.
Just a little bit, yeah. Just a quarter of a cc. That's good. Just enough to get a sniff. So we're going to do the medial branch of the dorsal ramus at L5 right, or L4 right now. And then this is, of course, the L5 pedicle, L5 transverse process, but the next one we're going to do the L5. Oh yeah, go ahead. Then we're going to do the last nerve, which is the one that rolls right over the top of the sacrum, and that is the L5 dorsal ramus. Shot. Let's see where we are. Shot. 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 There we go. Shot. What do you think, Jordan? Luis? I think it looks really damn good, huh? You got a shot there? Yeah. Let's see where that is, shot. It's wonderful because when this procedure works, it works really well. Sean? And you get this long-lasting pain relief, which is what we want. You can see I'm able to direct it. All right, we're done with that one. One more to go, 5 minutes. Shot. Can you all see the spot we're aiming for? Jordan, why don't you show them? That's it, right there. Shot. 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 Jeez. Shot. Shot. That is deep. Coker. Shot. Okay. Shot. That's really good right there. Go ahead, Luis. That's good. Nicely done. Last one. Just a few minutes and we'll be done. So we're going to treat the L45, L5S1 facets on the right because that's where he was having facet pain. And we're treating the left L5S1 facet. So right 4551 and left shot L5S1. Feeling all the scar tissue as I'm going in. And there's a lot. Shot. 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 Take that. Shot. Keeps going to the same place. Shot. That's strange. I feel like I'm on the bone, but there we go. Shot. No. Shot. No. Want to be a little more lateral. The scar tissue keeps redirecting this thing to where it wants it to go rather than where it should go. So, shot. All right. Shot. I just had to pull it out a bit and redirect it. I can feel it. So much scar tissue from his prior laminectomy. Shot. Now we've seen this scar tissue. There we go. In real life, when we do surgeries, open surgery, and it's really, really very dense and thick. Shot. Shot. That's like perfect, right? Doesn't get any better than that spot right there. Shot. Shot. That's perfect. Let me go just a little more shot. Yep. Lovely. That's it, folks. That's a wrap. Good job.
Thank you. Lights on,
Thanks,
please. Lights on.
everybody. Good work.
You did very well. Yeah.
All right, so we denervated with rhizotomy right L45, right L5S1, and left L5S1. And Dr. Patel also did a piriformis muscle injection because he had piriformis pain. Thank you, Henry.